Hello, everyone, and welcome to Module 4, Medical Services and Care Navigation in Multiple Sclerosis. This session is for adults living with MS, caregivers, and professionals who support them. Living with MS often involves contact with healthcare services over many years. Care may include neurological reviews, medication monitoring, rehabilitation, symptom management, emotional support, and practical assistance. For this reason, understanding how to navigate care is an important self-management skill. Today, we will discuss the multidisciplinary care team, diagnosis and follow-up, treatment and symptom management, preparing for appointments, communicating with professionals, recognizing warning signs, patient rights, and organizing personal medical information. The purpose is not to turn patients or caregivers into medical specialists. The purpose is to help people feel more informed, prepared, and able to participate in decisions about their own care. This module provides general education and does not replace individual medical advice. New or concerning symptoms should always be discussed with an appropriate healthcare professional. This module is organized into 6 connected areas. First, we will look at the role of medical services and the importance of multidisciplinary care. Second, we will discuss diagnosis, monitoring, follow-up, disease-modifying treatments, and symptom management. Third, we will focus on appointments and communication, what to prepare, what information to bring, and how to ask clear questions. Fourth, we will consider warning signs and the role of rehabilitation and support services. Fifth, we will discuss patient rights, shared decision-making, and self-advocacy. Finally, we will explore simple ways to organize medical information and reflect on which parts of care are clear and which parts need further support. Throughout the session, the central message is that good care is not only something that is delivered to a person, it is also something the person understands, prepares for, and participates in. MS care is not limited to receiving a diagnosis or being given medication. It is a long-term process that may include monitoring, rehabilitation, symptom support, emotional care, practical guidance, and regular communication with different professionals. The statement on the slide says, "Good care is not only about receiving treatment, it is also about understanding care, preparing for it, and participating in it." Let us examine these 3 actions. Understanding means knowing the general purpose of treatment, follow-up, tests, referrals, and safety monitoring. Preparing means bringing useful information and questions to appointments. Participating means expressing concerns, discussing preferences, and asking for clarification when something is unclear. Participation does not mean that the patient must make every decision alone. Shared care means that professional knowledge and the person's own experience are brought together. Our goals today are to understand how services support people over time, recognize the value of multidisciplinary care, prepare more effectively for appointments, and strengthen communication and self-advocacy. Medical services in MS have several functions. They help establish a diagnosis, monitor disease activity, manage relapses, review treatment, address symptoms, and coordinate referrals to other services. Diagnosis and monitoring may involve clinical assessment, neurological examination, MRI findings, laboratory tests where appropriate, and ongoing review of symptoms and function. Treatment review and safety monitoring are important because some medicines require regular checks. The care team may review whether treatment remains effective, whether side effects are occurring, and whether monitoring tests are needed. Symptom management is another major area. People may need support with fatigue, pain, spasticity, mobility, mood, sleep, bladder or bowel difficulties, cognition, or other concerns. Medical services may also connect the person with physiotherapy, occupational therapy, speech and language therapy, psychological care, social support, or community services. Care therefore changes over time. The right service depends on the person's current symptoms, goals, treatment, function, age, and life circumstances. A multidisciplinary team brings together professionals with different areas of expertise. The exact team is different for each person and may change over time. The neurologist usually has a central role in diagnosis, disease monitoring and disease-modifying treatment. An MS nurse, where available, may help with education, medication support, symptom questions, monitoring, and coordination. A family doctor or general practitioner remains important for general health, infections, vaccinations, blood pressure, other health conditions, and care that is not specific to MS. Physiotherapists may support mobility, balance, strength, transfers, and fatigue-aware exercise. Occupational therapists may help with daily activities, energy conservation, work, equipment, and home adaptation. Psychologists, counselors, psychiatrists, and social workers may support emotional health, adjustment, relationships, work participation, and access to services. The person with MS is at the center of the team. The team should not only talk about the person, it should communicate with the person. Care is strongest when professionals share relevant information and the patient's own priorities are included. Diagnosing MS requires careful assessment. Professionals consider symptoms, neurological findings, imaging, the pattern of changes over time, and whether another condition could explain the findings. For the patient, diagnosis may feel like the final answer after a long period of uncertainty. Medically, however, diagnosis is the beginning of long-term follow-up. Follow-up may include neurological reviews, MRI monitoring, treatment discussions, laboratory or safety checks, and assessment of symptoms and daily function. Good follow-up depends partly on what the patient reports. Useful information includes new symptoms, worsening of previous symptoms, side effects, falls, changes in mobility, unusual fatigue, bladder or bowel changes, mood difficulties, sleep problems, and cognitive concerns. It helps to describe not only the symptom but its effect. Instead of saying only, "I am more tired," a person might say, "For the last 3 weeks, I need to rest after getting dressed, and I can no longer prepare lunch without a break." Sudden or significant changes should not be saved for a routine visit if earlier medical advice is needed. Medical treatment in MS often includes 2 broad areas. The first is disease-modifying treatment. These therapies aim to reduce disease activity, relapses, and the longer-term burden of the disease. The choice of treatment is individual. It may depend on the form and activity of MS, expected benefits, possible risks, monitoring requirements, other health conditions, pregnancy considerations, lifestyle, and personal preference. The second area is symptom management. Even when disease activity is being treated, a person may still need support for fatigue, pain, stiffness, mobility, sleep, mood, cognition, or bladder and bowel problems. These areas should not be confused. A medicine that modifies disease activity may not immediately solve a daily symptom, and symptom treatment does not necessarily change the underlying disease activity. Treatment also includes monitoring and rehabilitation. A good plan asks, is the therapy effective? Is it safe? Are symptoms being addressed? Is the person able to participate in daily life? Patients should not start, stop, or change prescribed treatment without discussing it with the responsible healthcare professional. Medical appointments can feel short, stressful, or information-heavy. Preparation helps the patient use the available time more effectively. Before the visit, write down the main symptoms when they began, whether they are improving or worsening, and how they affect daily activities. Prepare a current medication and supplement list, including doses if possible. Note any side effects, missed doses, recent infections, falls, hospital visits, or major changes in sleep, mood, mobility, work, or family life. Bring relevant reports, scans, test results, or appointment letters when they are not already available to the service. It is also useful to prepare 2 or 3 priority questions rather than relying on memory. Example questions include, what changes should I report urgently? What side effects should I watch for? How will this treatment be monitored? What rehabilitation support would help me now? A trusted family member or support person may attend when appropriate, especially for complex decisions or emotionally difficult conversations. The patient should decide what role that person will have: listening, taking notes, helping describe changes, or asking agreed questions. At the end of the appointment, try to confirm the plan. What happens next? Who will arrange it? When should follow-up occur? Who should be contacted if something changes? Clear communication is a medical skill that can be learned. MS symptoms may be invisible, variable, and difficult to describe, so practical examples are especially helpful. A useful structure is what changed, when it changed, how often it happens, what makes it better or worse, and how it affects daily life. For example, during the last month, my right leg becomes much weaker in the afternoon. I have nearly fallen twice when turning in the kitchen, and I now avoid going out alone. This gives more useful information than simply saying, my leg feels strange. It is completely appropriate to say, I do not understand that. Can you explain the options again? Or, could you write down the next steps? Asking for clarification is not wasting time. Concerns should be stated directly and respectfully. If a symptom is affecting work, sleep, relationships, mobility, or independence, say so clearly. Functional impact helps professionals understand the importance of the problem. Before leaving, patients can use a teach-back approach. Let me check that I understood. I will continue this medicine, have this test, and contact the clinic if this symptom becomes worse. Is that correct? People with MS should not panic about every temporary change, but significant new symptoms should not be ignored. It is useful to know in advance who to contact during working hours, after hours, and in an emergency. More urgent advice may be needed for a significant new neurological symptom, marked worsening of function, serious medication side effects, signs of infection during treatments that affect the immune system, swallowing difficulty, rapid unexplained deterioration, or a severe mental health crisis. The exact response depends on the symptom, severity, treatment, and local healthcare system. The person may need to contact the MS team, family doctor, urgent care service, emergency service, or another designated provider. It is also important to consider possible triggers such as infection, fever, overheating, poor sleep, or medication problems. However, patients should not try to diagnose a relapse or rule out an emergency by themselves. A written urgent care plan can reduce confusion. It should include important contact numbers, current medications, allergies, diagnosis information, and clear instructions from the healthcare team. If a person has sudden severe symptoms, difficulty breathing, severe swallowing problems, loss of consciousness, signs of stroke, or cannot remain safe because of a mental health crisis, immediate emergency help is needed. MS care should not be reduced to neurologist visits. Rehabilitation and support services can help people maintain function, independence, participation, and quality of life. Physiotherapy may address mobility, balance, strength, transfers, exercise, and fall prevention. Occupational therapy may support daily activities, fatigue management, home or workplace adaptation, and assistive equipment. Speech and language therapists may help with communication or swallowing difficulties. Psychological services may support adjustment, anxiety, depression, stress, confidence, and family relationships. Social workers or community services may assist with paperwork, disability support, transport, caregiving, employment, housing, or access to practical resources. Referral is most useful when the problem is described clearly. Instead of asking only for rehabilitation, explain the goal: safer showering, returning to work, reducing falls, managing fatigue, or improving swallowing safety. People do not need to wait until a problem becomes severe before asking whether a referral would be helpful. People with MS have the right to understandable information, respectful care, involvement in decisions, privacy, and the opportunity to ask questions. Depending on the healthcare system, they may also have the right to access records and request a second opinion. Shared decision-making means that professionals explain the reasonable options, benefits, risks, uncertainties, and monitoring needs. The patient contributes personal priorities, concerns, lifestyle, and preferences. Self-advocacy does not mean aggressive confrontation. It means communicating clearly when something is unclear, unsafe, or affecting daily life. Helpful statements include, "I would like to understand my options. This symptom is affecting my daily life more than before. I need help understanding the risks and benefits. And can we discuss other support services? A patient may also say, I need more time to think. Could I receive written information or I would like a support person present for this discussion. When communication is difficult, documenting concerns, requesting clarification, or asking who is responsible for the next step can help. Respectful persistence is sometimes necessary in complex systems. Long-term care may involve many appointments, professionals, medications, tests, referrals, and reports. A simple organization system can reduce stress and prevent important information from being lost. The system does not need to be complicated. A notebook, paper folder, phone note, secure digital file, or combination of these may be enough. Useful sections include a current medication and supplement list, allergies, diagnosis information, MRI and test dates, relapse history, side effect notes, appointment questions, rehabilitation contacts, and important telephone numbers. After each appointment, write the date, the main decision, any treatment change, planned tests, warning signs to watch for, and the next follow-up step. Information should be updated. An outdated medication list may create confusion, so add the date when the list was last reviewed. Digital information should be protected with appropriate privacy and security. Avoid sharing sensitive medical information through insecure channels unless advised by the service. The aim is not perfect record keeping. The aim is to find essential information quickly when it is needed. Reflection helps identify gaps in care navigation before they become larger problems. Ask yourself, do I know who to contact for different problems? Do I prepare for appointments? Do I understand the purpose of my treatment and follow-up? Which symptoms do I tend to minimize or avoid mentioning? People sometimes minimize symptoms because they do not want to complain, worry that they will not be believed, or believe the problem is not important enough. However, a symptom that affects safety, sleep, work, mood, or independence deserves discussion. The exercise on the slide asks for 3 things: one part of care that already works well, one part that feels confusing, and one question to ask at the next appointment. This approach is deliberately small and realistic. The goal is not to solve the entire healthcare system in one day. The goal is to identify the next useful action. Self-monitoring should support communication, not create constant worry. Records can be brief and focused on meaningful changes. MS care usually requires long-term follow-up, not only diagnosis. Needs may change over time, so regular review and communication remain important. Multidisciplinary care can address medical treatment, symptoms, rehabilitation, emotional well-being, and practical daily needs. Treatment may include disease-modifying therapy, symptom-specific management, monitoring, rehabilitation, and general health care. Preparing for appointments and describing changes clearly can improve the quality of communication and decision-making. Recognizing warning signs and knowing who to contact are important safety skills. People with MS have the right to understandable information, respectful care, involvement in decisions, and appropriate opportunities to ask questions or seek further advice. Organization and self-advocacy do not need to be perfect. Small practical habits can make care safer and less confusing. Good care is not only about receiving treatment, it is also about understanding the purpose of care, preparing useful information, asking questions, and participating in decisions. No patient should be expected to navigate a complex healthcare system perfectly. Confusion, fatigue, memory difficulties, emotional stress, language barriers, and administrative demands can all make the process harder. The answer is not perfection. The answer is using small tools, a short question list, a current medication record, a support person, a clear symptom description, and knowledge of who to contact. Being an active participant does not mean facing everything alone. It means using professional support, family support, rehabilitation, community services, and personal knowledge together. I invite you to leave this session with one practical action. It may be updating your medication list, writing one appointment question, identifying an important contact, or asking for a referral that could support daily life. Thank you for your attention and participation. The goal is to feel more informed, more prepared, and more confident that your concerns can be heard.